Chalk talks. You've heard of them, but what exactly are they? And why are they critical for busy educators like us who are always on the go? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Learn more from Dr. Dietsche on how she incorporates chalk talks into her daily practice and tips for you to integrate them into your educational practice too.
Do you want to do more teaching in the clinical setting, but find rising clinical demands and limited time a challenge? Are you teaching learners, but find it is hard to keep their attention and ensure the information sticks? If so, Chalk Talks might be a good teaching tool for you. What does the evidence say about Chalk Talks? We know that setting aside time to teach in a deliberate way increases learner perception that their attending is a great teacher. We also know from dual coding theory that appealing to multiple learning styles, specifically auditory and visual, improves retention in all learners. And we know from adult learning theory that adult learners want to learn something relevant that they can use here and now. I am Dietsche, hospitalist at the University of Colorado and director of the Internal Medicine Residency Program's Clinician Educator Pathway. I am also a Chalk Talk enthusiast. I have been giving Chalk Talks since I was a resident, and now I am here to share my experiences so you can fast-track your educator skills as faculty. First off, what is a Chalk Talk? Sometimes referred to as whiteboard mini lectures, it is a formal, small group didactic with a visual component. It is usually 10 to 20 minutes in length, but if you ask your interns, arguably our busiest trainees, they will say 10 to 15 minutes max. So how do you create and deliver a Chalk Talk in our busy clinical environment and make sure it hits every time? Let's talk about 5 tips for a successful Chalk Talk. How to 1. Choose your topic and main points. 2. Plan your board. 3. Optimize engagement. 4. Save, share, and repeat. And 5. Mind the gap. Step 1. Choose your topic and main points. Pick a topic relevant to your learners. Generally, this will be related to a patient you saw together, a question that came up that week, or maybe even a topic your learners asked you to teach more about. Next, be realistic about what you can cover in 10 to 15 minutes, and start with the end in mind. What are the 2 to 3 main points that you want your learners to know well after your talk? These should be the highest yield content, and you should keep your talk focused on this information. Step 2. Plan your board. An effective board is one that enhances understanding and improves retention of the information. Have a plan. Consider an advanced organizer, which is a visual that universally is understood that you can overlay your talk on top of. This can be as simple as a list, a table, stick figure, or maybe more complex like an anatomic schematic, Venn diagram, timeline, pyramid, steps, a scale, etc. Step 3, optimize engagement. With only 10 or so minutes, you need to engage your group from the very start of your talk. Great hooks appeal to shared emotion, allow learners to share what they know about the topic, and/or convinces them why it's important. Remember that you're having a conversation, and if you are, they are engaging. It doesn't have to be a rigorous Q&A session, but it can be a discussion of their experiences, their questions, their thoughts, and that will keep them engaged. Step 4, save, share, repeat. Take a picture of your board and save it in an easily accessible place. I store mine in a folder in my phone under my Pictures app, and this allows me to use it easily in the future. Allow your learners to also take a picture as well, so they can use that as a reference for the material later and to use it as a jumping off point when they want to teach that topic in the future. Step 5, mind the gap. To deliver a successful Chalk Talk, you need to prepare, but your learners need to prepare as well. Ask them when they have time for a talk and recognize that there will be days that are too busy for formal teaching. Be flexible, make a plan that works for you and your learners. So the next time you're preparing to give a Chalk Talk, remember, 1, choose your topic and main points. 2, plan your board. 3, optimize engagement. 4, save, share, and repeat. And lastly, mind the gap, step 5. Good luck and happy teaching.